I suffered with pelvic pain symptoms postpartum. Really started during my final trimester with my first child, where I had some SI joint pain, a little bit difficulty walking, but it really was a long delivery, vaginal delivery, and then I had the classic, postpartum pelvic pain that we see at PRM, with pain with intercourse, bladder, urgency, frequency, burning, sensation of a UTI, and just some pain with bowel movements and constipation. I waited to my 6-week follow-up, went to my OBGYN, and she said, "Allyson, everything looks great. There's no infection, no UTI. Your ultrasound's perfect. Everything really looks good. So I'm not really sure, but why don't you just see if it goes away on its own?" It didn't go away, so I went back to her about now 3 months postpartum and said, listen, it's still pretty bad. What's going on? And she said, "I don't know. Like I said, the workup, everything looks great on my end. Exam looks great. Maybe you want some pain medication, so some Percocet." I said no, and then went on my way. I found a pelvic floor physical therapist who really helped kind of introduce me to the world of the nerves and the muscles and the pelvic floor and the pelvis, and really helped me get about 30-40% better, which was amazing. But I didn't get all the way. I just need a little more. So then I went and looked for any other options out there, and I didn't like what was offered. It was all blind, transvaginal treatments or using, medications such as Botox and freezing the pelvis, or using these big needles to address the different nerves of the pelvis. None of the options I liked. So I created something that was safer, more comfortable, and more efficacious, really. Essentially that it was external, ultrasound guided, because I am a rehab doc and we are trained to use guidance and ultrasound. And as the majority of our patients are females, I also didn't want to use any guidance that required radiation around the pelvis, such as the fluoro suite. So ultrasound is a better option for our young female patients looking to avoid radiation. And I wanted something where you could go on with your day. So no downtime, get a treatment, go on with your day. And so that is what we created. And it's really this multimodal protocol where you work with us in pelvic floor PT and sometimes behavioral health, and that holistic, functional, restorative approach to rehab those dysfunctional nerves and muscles in the pelvis that cause pelvic pain.